Nicole. Let's talk about it. Tell me all about it. I'm here. I wanna know what's on your mind. Ooh, the world needs to hear from you, and I'm so glad to have a conversation to reach the nation. And it's all about you. We'll help each other to discover innovative ways to positively change the world. Let's talk about. Let's talk about. Yeah. Let's talk about conversations with Nicole.
Greetings. Happy Wednesday. Welcome to Conversations with Nicole. I am Nicole Everett, your host, and Conversations with Nicole is a talk show based in Tallahassee, Florida, focused on connecting the community through conversations. And today is what I call Wellness Wednesday, which is an opportunity for you, me, and my guests to chat about whatever it is we want to talk about. And today's topic is mental health diagnosis and holistic approaches to care. Mental health diagnosis and holistic approaches to care. May is Mental Health Awareness Month, and my very special guest is Miss Keyunda Washington, who is a clinician here in Tallahassee. And so I'm super excited and delighted to have her here with me today. But before I bring her on, I need to hear from you. Where are you tuning in from? We want to know. Please put your city and state in the comments. We are live on Facebook, on YouTube, and on LinkedIn, and your comments and questions are welcome. This is an interactive conversation, and we want to hear from you. So we invite you to join in on this topic of mental health diagnosis and holistic approaches to care. So I see a few of you on, but no comments as of yet. I'm sure you all will be joining us shortly. But I am going to go ahead and share some of Keyunda's bio. Keyunda Washington, referred to by family, friends, and clients alike as Key, is a licensed mental health counselor who is passionate about addressing mental wellness. Her practice, Holistic Healing Counseling, was founded on the principal beliefs our mental health is interconnected with our physical and spiritual well-being. Therefore, the focus is to help clients align those elements for improved overall health. While she affirms and serves all races and ethnicities, her practice highlights the holistic health of students and working professionals who identify in the BIPOC community with a specialty focus on Black individuals. Keyunda obtained her master's in clinical mental health counseling from Walden University in 2015. Prior to that, she studied psychology at both the associate and bachelor's level at Dartmouth College and Albany State University, respectively. Over the past decade, one of the main things her personal, postgraduate, and professional journeys identified for her was the need to respect Black health from the scope of being a Black client and a Black clinician. Her top interests are treating racial trauma, depression, and anxiety. In addition to her role as a therapist, she also is both a cat and toddler mom. For self care, she counseling, spa, massage, and acupuncture. As your stereotypical introvert, what she enjoys above all else is the chance to sit in pure silence. Y'all help me welcome Miss Keyunda Washington. Yay!
Hey,
Hey. Thank you for being here.
thank you for having me.
My pleasure, my pleasure. So I know I read a bit of your bio in terms of your achievements and your educational journey, but tell us a little bit more about who you are, not what you do, but who are you?
Who am I?
Yeah.
Well, another part of who I am, as you mentioned, being a toddler mom, I have a 2-year-old. She will be 3 this November.
Mhm.
And that's been the greatest joy of my life, discovering becoming a mom, just having a mini version of myself. Um, I guess additional things that I like to do for fun outside of just like the self care. I
Mhm.
want to be able to travel. I've actually outside of going on a cruise, I've never really traveled outside of the country and experienced culture to the degree that I want to. So having a 2-year-old and wanting her to have like more experiences than me, I'm really looking forward to being able to gain some additional cultural experiences as well.
Mm-hmm. My sincere apologies for that technical difficulty. You know how the internet is. Sometimes it just won't let you be great. All right, so we're back. My apologies. So you were sharing who you are, and I know you mentioned about travel. So
Mhm.
hopefully you'll get to do that one day soon,
Mm,
because
yeah.
travel is a wonderful thing, being able to see different cultures and
Mm,
whatnot. So I wish
mm,
that for you and for anybody that wants to travel. It definitely gives you a different perspective on life.
right. I took the first step. I got my passport a couple years ago. Just still
Okay.
haven't been in Newark yet. So.
Yes, yes, yes. All right, wonderful. So, because I have a clinician on, I definitely want to read my disclaimer before we get started in our conversation. And that, hold on, y'all, bear with me. That basically is that all topics, past, present, and future, on Conversations with Nicole are for informational purposes only. They are not to be used as a diagnosis for treatment or an answer to any personal issues related to the topic being discussed before, during, or after the program. All right, so let me give a shout out to the folks that have joined us. Dr. Williams, Edward Williams, who's here in Tallahassee. Thank you for being here. Miss Jeanette Tullis in Miami Gardens. Thank you for joining us. And Dr. Mark Reeves, who actually is how we got connected, kind of, sort of, through the Mental Health Council of the Big Bend. So I thank you for being here, Dr. Reeves, tuning in with us. Appreciate you. And yes, we are back. Also, Miss Keisha Washington, who is here in Tallahassee. Thank you for being here. Oh, Miss Debbie Henderson, who's also here in Tallahassee. Thank you for being here. So, again, May is Mental Health Awareness Month, and tonight we're going to be talking about mental health diagnosis and holistic approaches to care. So, I think a good place to start would be just kind of defining what a mental health diagnosis is.
All right.
Okay.
So a mental health diagnosis. So essentially, we can kind of think of it as, how if you're going to your primary care physician, they kind of ask you like what you're coming in for, what sort of things are going on, based on that, they add a description, to your medical record, whatever it is, whether you're having heart pain, heart conditions or headaches, migraines, anything like that. So it's essentially kind of assessing what's going on, what's bringing you in, and then based on those symptoms and assessments that we do, we kind of use what we call the DSM, the Diagnostic and Statistical Manual, to make a diagnosis. So that's pretty much the technical answer for what mental health diagnosis is.
So I'm gonna get the viewers involved. How many of you are familiar with a mental health diagnosis, or aren't familiar with a mental health diagnosis? How many of you, either have had personal experience of it, with it, in terms of something that you have had or a loved one, or you really don't know much about it? Just let us know in the comments. Yes or no, thumbs up, thumbs down. Let us know. Let us know. Let us know. I will tell you that for me, it's something that I, prior to being involved with the Mental Health Council, really wasn't all that familiar with. I mean, I think I've probably heard people kind of throw terms around like depression or bipolar or schizophrenic, but really still didn't even know kind of what that was in terms of it being a diagnosis. And so I think it's good to, well, number one, kind of understand what the diagnosis is and how you even get to the point of having a diagnosis. And we'll kind of, flush some of that out. But I think that, and also I think in our society, in our culture, maybe some terms have been thrown around with us not really even fully understanding what those terms mean, you know?
Yeah, I
Yeah,
agree.
right.
As you were mentioning that, it definitely made me think that sometimes whenever, let's just say that someone may be feeling sad because they got some tragic news, there's a difference between just kind of like feeling low or having a depressed mood versus clinical depression. And
Yes.
so I do think that, sometimes those terms could be thrown around, even when you think about the term bipolar. It's like, oh, your mood is swinging left and right, so you're bipolar. So I definitely think that understanding exactly what a diagnosis is, that it means that you have to meet certain criteria, is a part of that.
Yeah, and it has to do a lot with your ability to function normally.
Right.
And so oftentimes, and correct me if I'm speaking in error, but if you aren't functioning the way you normally function for an extended period of time, that is a contributing factor to you having this diagnosis as well.
Right. That is a part of it. Just, so with certain diagnoses, it is a matter of looking at how long you've been in that state. Sometimes, with just kind of like a depressive episode, have you been experiencing these things for at least 2 weeks? So we assess for stuff like that and the severity of it. Whether it's mild, moderate, severe. So it's definitely, and in what areas of your life is it being impacted? All areas, work, home life, school, or just kind of like one area.
Yeah. So just again to be kind of clear, in terms of receiving this diagnosis, where can folks get the diagnosis?
Yeah, well, seeing a mental health provider, whether that's a licensed clinician, a master level, or even a psychiatrist, nurse practitioner, just anyone who is completing like a mental health assessment, can make a diagnosis. Usually, that process is a little different. Like when we do like an initial evaluation, is what we call just kind of like a preliminary diagnosis. We just kind of make a quick assessment based on background information that we're getting, what sort of concerns that you're having in different areas of your life, from a biological perspective, social, emotional, we look at all those areas and we make an initial assessment. Most often, especially when we do a really in-depth assessment, it ends up being like a longer term diagnosis, but sometimes things can kind of come up over time where it shows that there may not have been the most appropriate diagnosis and it needs to be updated from there.
Gotcha. Okay. So we got a few more folks that have joined us. Sharice Du Bois, who's in Atlanta. Thank you for being here. Happy Wednesday. Miss Deborah Lloyd, who is here in Tallahassee. She said, great topic. Thank you for being here, Miss Deborah. And Miss Dorothy Potter, who is also in Miami Gardens. Glad you are able to be here. Thank you for being here, Miss Potter. Miss Deborah said, can you give more info on the difference between situational depression and clinical depression?
All right, thank you for the question. I think that when it comes to situational depression, it's really a matter of kind of looking at some of the circumstances that are influencing it. So let's just say, for instance, that, unfortunately, someone close to you has passed away, and as a result, you feel sad, and that's something that's been going on for, a few weeks, a few months. And so, but, as time passes, whether there's, receiving grief counseling or just kind of like whatever way that kind of helps you kind of cope with processing the grief and loss. If those feelings kind of, dissipate and kind of lessen, then it's more based on a situation in and of itself. Clinical depression is a little bit different, where it's more of, there's more in tune with like other areas of your life. Like for some people, it can literally be like a chemical imbalance, where that's why some things can be genetically based, where your brain doesn't naturally produce the chemicals, doesn't naturally have the serotonin levels or the dopamine levels to kind of regulate your mood. So it's difficult to kind of stay or have like an even keel or like an upbeat personality or temperament on a much more severe level that doesn't necessarily have to do with the situation itself. Just day-to-day life can be difficult, going to work, getting out of bed, taking care of things at home, where it becomes more of a clinical, more of a severe, I guess is the best way to explain it, more severe than just being specific to a situation.
Okay. I hope that answers your question, Miss Deborah. If you need a little more, just let us know. But great question, because again, like I think that term in particular, I feel like we kind of throw that around a lot, without really knowing, clinical versus situational. And, in the example that you gave in terms of, the loss of a loved one, in particular, it's normal to grieve or be sad or what have you. And even probably for, not a lengthy time, amount of time, to maybe not be motivated to do certain things because you're overtaken with the grief, right?
Right.
Mm. All right. So she had another question. Can situational depression become clinical?
Yes. Yes. As Nicole was mentioning that, like whenever there's a situation like experiencing the loss of a loved one and you have the situation of depression, if it's something that's pervasive, and it's kind of difficult to kind of, put a label on like how someone should grieve or how long it should last. But when it becomes pervasive, where it's very difficult to function, um, and there's no decrease in the symptoms, like things aren't progressively getting better, or they seem to be becoming more severe, and that's when we look at it becoming more clinical in nature.
Yes. Okay. Thank you for sharing that. Keisha said, growing up, I've seen many who didn't function like the quote unquote norm. However, I don't think they were diagnosed clinically. The street committee diagnosed them. Yes, we probably see a lot of that. Would you agree?
I agree.
Mm-hmm.
Oftentimes, when I'm doing assessments with clients and we're looking at family history, they'll say, well, they didn't really, we don't believe in, therapy, or no one got diagnosed, but I believe that my mom, was depressed, or I think
Mm-hmm.
my mom had bipolar disorder, but no formal diagnosis.
Mm-hmm. Yeah. Deborah said, good stuff. Thank you. You're welcome. All right. My mom has just joined us down in Miami. Thank you for being here, Ma. We got Miss Peachy on here in Tallahassee. Thank you for joining us, Peachy, and Mr. Warren Cave. Thank you for being here, Brother Warren. We appreciate you. All right. So that gives us a little bit on diagnosis in terms of it being an assessment, there being the DSM, which I call the mental health Bible, which
Right,
kind of gives you the guidelines on the particular diagnosis in terms of different symptoms or behaviors, the length of time that maybe this behavior is taking place, and your ability to function, right?
right.
Mm-hmm. And so once a diagnosis is maybe given to a patient, then what?
That informs treatment approaches. I think that, just like we use the DSM to kind of give us criteria for what sort of symptoms typically fall up under a certain label, we
Mhm,
use those same things to kind of get an idea of what sort of approaches may be helpful to the client. And so, just kind of thinking about, for me, like working with trauma, there's a certain set of, modalities that I like to use that I've gained experience in that have proven to be effective. So you have like the evidence-based therapies, but it's also a matter of what type of techniques the clinician uses as well. Because I think that for me, I'm such a cognitive person, so I'm really drawn to a lot of modalities that integrate the CBT focus, and just like the strength based and narrative based. And so, based on like who I am as a person, it kind of really influences what type of approaches I bring into my practice.
mhm.
So, I think I lost track of the question. You had
Okay, well, no, you're answering it. My question was, after you received this diagnosis, then what? And then you
then
mentioned
what?
treatment. So,
And treatment
um,
approach,
so just so you all know, she mentioned CBT, which stands for cognitive based therapy.
cognitive behavioral therapy.
Cognitive behavior therapy. So tell us a little bit about what that is in terms of a treatment.
So with that, it's really getting a better understanding of how clients process things logically. Because through the CBT, or cognitive behavioral therapy approach, is looking at, A plus B equals C. The way that you think about things impact the way that you behave in the way that the emotions that you feel as well. And so it's looking at where in this process can we shift things around. And the traditional model is targeting, let's, target these thought processes. Are there some negative things? Are there some distortions, some unhealthy ways about thinking about it that we can kind of restructure? And in doing that, it's supposed to have this domino effect where now, maybe the way I'm behaving can change a little bit. The emotions that I'm feeling can shift. I would say that even though I primarily operate by using CBT, it doesn't necessarily have to follow that same flow. Like I kind of base it around the clients. If they are more motivated by focusing on their emotions first, then we can find ways to target that and almost kind of reverse order it. So, but that's pretty much the modality that I identify with the most.
Okay. So the cognitive behavioral therapy is one. What about some other treatments that may be a little non-traditional?
Non-traditional. Hmm. Non-traditional.
So have you had any experience with, say, acupuncture
Okay,
or
okay. Let's see. So, I do think that with things like that. So personally, this year, I did get into. We're starting last year. Actually, I got into doing more alternative approaches. I've always been a big believer in massage. And the connection between how our emotions kind of, stick in our body. For me, I carry stress like in my shoulders and my back, and so. I believe in massage therapy as well as acupuncture.
okay.
And I think that, for some clients, they're really, especially a lot of clients in my practice, they're really against like the traditional models of, medication management. They'd rather explore more holistic approaches. So I
Mhm.
definitely think that, for some things that clients are experiencing, that those alternative routes can be helpful.
Okay, very good. Let me pause and we have Miss Jackson on with us. She said, "This is good. Wonderful. Thank you for being here." All right. So we are almost at about halfway through our talk. So for those of you who may be just joining us, I'm on with Miss Keyunda Washington, who is a clinician here in Tallahassee, Florida. And we are talking about mental health diagnosis and holistic approaches to care. Thus far, we've talked about kind of how you go about getting diagnosed, with an assessment, with the clinician looking at the DSM, which is the mental health Bible,
Right.
and coming up with a diagnosis. And then what's next is treatment. And
Mhm.
so, that treatment could be talk therapy, it could be um, prescription or some psychotropic medicine, it could be massage therapy, it could be
Mhm.
acupuncture, it could be tapping, tap therapy, or and I don't know, it's not called tap therapy, but we've had someone on that gave us like walked us through some tapping exercises. It could
Right.
be art therapy, it could be music therapy. So there are a bunch of a number of modalities that could be used to help treat a diagnosis, right?
Right.
It- as well as a combination. It doesn't have to just be one thing. It could be several things, correct?
Mhm. Yes. I think that that's often the most appropriate and just kind of like an integration of different things.
Mhm. And so with the integration of things, um, has it been your experience, or have you in treating maybe the clients that you see, that you have used a number of different modalities or techniques?
But for me, I do consider myself outside of CBT also integrative. So just kind of thinking more on the therapeutic side, I'll integrate different techniques, just kind of based on my client's personality. So I think that's the most effective, as opposed to me just kind of like inserting just like one method in one mode. But in
Okay.
terms of integrating other things, I do make recommendations quite regularly, depending on what it is, even to like a psychiatrist, and I make referrals for like massage, acupuncture, just kind of different things to kind of manage that. So yes.
Okay. Wonderful, wonderful, wonderful. What about any type of movement? Like, have you found movement to be helpful? I've heard of somatic, which takes movement into consideration in terms of moving energies through our bodies and that sort of thing.
Right. I do agree with that. More often than not, I don't kind of go more so in that method because I'm not as familiar with it. But in terms of just kind of generally being active, I do encourage like different grounding techniques. So a lot of times I'll do like mindfulness based techniques with clients to kind of help redistribute their focus and their energy.
Okay. And can you tell us just a little bit more about that in terms of what you might do,
Yeah.
um, in terms of a mindfulness technique to help kind of ground the clients?
Mhm. And so a couple of my go-tos is what we call, it's either called the five senses or the 5 4 3 2 1 method. So
Okay.
essentially, and I may not get the order completely correct, but I think it starts with like 5 things that you can see, 4 things that you can hear, all the way down, of course, going through your 5 senses. And so with that, let's say for instance that a client is feeling particularly, stressed about something, they're kind of ruminating on it, having intrusive thoughts. Then if they feel particularly overwhelmed, as a way to kind of refocus, we kind of let's focus on what's in your immediate environment. It's kind of like a distraction essentially. So they'll look around the room and literally search for 5 things in the area. Maybe the most difficult is maybe one thing that you can taste, but usually it's like if they're drinking something, what is that? What are you drinking? What does that taste like? But
Mm-hmm.
also, I think something that's also grounding is for depending on like texture. Like some clients, they prefer like when it comes to like stress balls. Some of them may like something squishy in their hands, so they get like a squeezy ball. Some people prefer something hard, so they'll get like the hard stress balls that you can roll in your hands.
Yes.
Fidget spinners, all of those things is kind of like our form of distraction.
Okay. So I'm gonna pull our viewers in. Do any of you have any types of and these really to me are like what I kind of label or deem as kind of coping skills, like things to help ground you or maybe if you feel your emotions rising to a place where you feel like it's about to be more than you can control, these things kind of bring you back, right?
Mhm.
So that doesn't so that you can regulate your emotions or not get overheated or overwhelmed or whatever the case may be. So
Mhm.
I'm asking the viewers to, in the comments, if you will, again, safe space for us to engage and communicate with one another. What are some of the things that you all use to kind of ground you and bring you back or calm you down, maybe if you are feeling like your emotions are gonna get the best of you? The thoughts switch that cognitive triangle, right? Your thoughts
Right.
turn into those feelings, or manage your feelings, control your feelings, and your feelings control your actions. I will say for me, music does that for me. Some soothing mood music is definitely something that I is a go-to for me. Also connecting with nature, so maybe just I don't even have to go outside. I could just look out the window at the trees or
Mhm.
birds or the squirrels or whatever. Just looking at nature does that as well. And then for me, also sitting quietly and meditating, that also does it for me. So yes. All right. We got a number of folks who are chiming in, and I appreciate you all chiming in. Let me first give a greeting to Miss Tina, who is tuning in the Tampa area. Thank you for being here. She speaks solutions. All right. Clary Pierre, she said hot cocoa or balloon breathing. Yes,
Mhm.
that breathing is so important. That's another one that does it for me. So thank you for sharing that. We got Miss Iris on. Thank you for being here, Iris. She said journaling, dancing, exercise, prayer, and listening to music all help me. Nice. Thank you for sharing that. Iris. Stephanie, thank you for being here. She said music, wonderful. Dr. Reeves, music, prayer, deep breathing, relaxing bath. Ooh, you just reminded me of another one. That bath, I need to do that.
Mhm.
I need to do that tonight. Artwork, walk, exercise. Yes, all great ones. Yes. All right. Clary said, or praying. Yes, that is another great one. All right. Oh, my cousin Nora's on it from Virginia. Thank you for being here. Good evening, Nora. All right. Dr. Reed's pet cats for calming and comforting texture. Yes. I know the dog moms, the cat moms, the pet moms,
Mhm.
their fur babies can definitely provide that as well. All right. And Peachy said music, journaling, or standing outside. Yes, all great ones. Thank you all for sharing. Appreciate that. So we just, I feel like those things we really need to use as tools at our disposal for those times that we need them, and draw on them, and don't forget that we have them at our disposal to draw upon. So, as we are mentioning these tonight, maybe there's some that you have not used or weren't aware of, and you can pull it out and use it and let it benefit you, right? All right, we got Coach Anna Woods on. Thank you for being here. She's in the Orlando area. She said deep breaths. Yes, walking barefoot on the grass. Yes, that is a good
Mhm.
one too. Love it, love it, love it, love it. All right, and Miss Debbie. Nice. Okay. She said my daughter was a victim of bullying through her school years, which caused her to shut down. She has never been the same. She's very lonely and sad. Oh, I'm so sorry to hear that. Are there any group activities I can get her involved in, such as meditation sessions, yoga, etc.? It breaks my heart seeing her day in and day out being so lonely. Please help. She further said she's now 32.
Hmm.
So I do believe there are some options. So we'll connect. We'll connect. And I don't know, Keyunda, if you have some recommendations or suggestions for that as well.
You said she's in Orlando?
No, she's here. She's in
Oh,
Tallahassee.
she's in Tallahassee. Oh, okay.
Mhm.
Um, she's 32.
Yeah.
There are some things I can't think of them immediately. I know that there are a lot of like providers who provide like group therapy. Um, but I can't think of anyone in particular right now. Something I would have to research.
So I actually know of a group, Miss Debbie. So I'll put you in touch with the person who puts that on. All right. And definitely sending thoughts, love, peace, prayers, and just wellness to your daughter. All right. So Miss Anna also said coloring. Yes, I know that adult coloring books are very popular.
Mhm. I
Mm,
love those. I really do like the mandala, like the tiny, just the tiny. It takes so much time, but I really love it.
mm-hmm, mm-hmm. Yes. Warren, he said, listening to this just helped me. Today was one of those days where I went into an empty parking lot, vented to God, cried, and just sat there for about 20 minutes quiet. And it always refreshes me. Thank you for sharing that, Warren. I can definitely understand. We actually had a show on grief recently, dealing how to manage unresolved grief. And this right here is exactly what we were talking about, is, just taking that time to grieve whatever is going on, right? Because what happens is, and I know I can speak for myself, I tend to hold on to those things that I'm not very pleased with, and it builds up and then comes out at a very inopportune time. And so my guest talked about us grieving like once a week, like taking time to cry. That's a healthy release, and we feel very we're very refreshed. It cleanses, and we release a lot of tension, a lot of anger and frustration and sadness and disappointments and all of
Mhm.
that. So definitely encouraging us to do more of that. So that is definitely a a coping mechanism, uh, a coping skill, a treatment. Look, that
Right.
holistic approach to care,
Right.
this is one of them. So thank you for sharing that, Warren. All right, Dr. Reeves said an awesome therapist like Keyunda could help her work through the bullying trauma if that is making her stuck and not feeling up to trusting people. Yes. Okay. I agree. I agree. And we can definitely will give Keon this information at the end of the broadcast. So Debbie said, I've asked her therapist, but there's no information he can provide. Thank you so much for sessions like this. It helps my mental state. Yes. Well, glad to be here. This is what it's all about. But we definitely will get you some resources after the broadcast. So, okay. So, we have talked about some of these holistic approaches to care. And then I think talk therapy can also be very helpful, right?
Right.
hmm hmm And so with talk therapy, what are you seeing in terms of the length of time that you have clients? Are you seeing them for longer times than maybe pre-COVID, or how's that kind of working out?
Hmm. Well, I would say that because I have a big focus on working with trauma, that most of my clients are long term. So I've had ever since I switched over into private practice, a
Yeah.
lot of my clients, the majority of them, I still have. So it's been like over a year.
Okay.
But I guess just depending on what they're coming in for, like for some people, it's just kind of improve like social anxiety or
hmm
workplace stressors, and usually those things are more short term, anything from maybe a month to 3 months, but most time just long term therapy.
Yeah. So what would you say to somebody that was skeptical about a diagnosis?
I would definitely say that, I would validate it. I think that this may be like a weird thought, that just weird connection that I'm making. But the first thing that pops in my mind is that, and this isn't mental health, but just thinking that, whenever I go to my primary, every time I see one of my conditions, that, technically, I guess by medical standards, I'm obese. And I hate seeing that in there. I hate seeing that they've diagnosed me with obesity. It really bothers me. So it's
Mhm.
valid to have concerns like about your diagnosis and what you're labeled as. I think it's so. I try to be transparent with clients, especially for those who are using insurance. And there's a requirement that we have a diagnosis to support, like what we're providing services for and what they're paying for. And
Mhm.
so for me, I think, just in general with mental health being stigmatizing, and then even within that, there are certain diagnoses that carry a heavier stigma. And so if we can get treatment with the least intrusive, I call it like intrusive diagnosis, um, or if majority of like what's going on can be explained by one diagnosis, then I try to be careful about not adding multiple diagnoses if it's not necessary, and definitely using the least stigmatizing diagnosis that I can provide in order to at least meet the insurance requirements.
Gotcha. So and I hope you all are catching what is being said, but for insurance purposes, a lot of times a diagnosis is required in order for you to receive whatever the services are that the clinician is providing, right?
Mhm.
Now, I will tell you, when I was working with a healthcare agency last year and the year before last, one of the things that I heard from a number of clinicians of color is that it they were seeing clients that needed more counseling than maybe the employment assistance number of sessions that were provided, but they would have to, in order to get the more adequate number of sessions that they needed, they would have to code the client as something that maybe they weren't necessarily. You know what I'm saying? Uh,
Mhm.
And so that was definitely a concern of the clinicians because they didn't want to they didn't want to put something on the person's record that really didn't reflect what was going on with them, although they did need more sessions. Right.
Right.
And so this to me is where the advocacy comes in for more sessions, especially with our insurance carriers, right? So instead of maybe, and I don't know what the sessions, what the number of kind of regular sessions are, but instead of saying, 6 sessions, I need 12 sessions or 15 sessions. So again, this I'm marking this because this is where again that whole advocacy piece comes in with our legislator or our policymakers to advocate for that. It's something that we are in need of. I
Right.
think especially post COVID.
Right.
Hmm.
And there's more of an issue with the EAP versus the insurance. There are some restrictions with it. Like, say, for instance, typically the minimum of once a week is, pretty normal. But if you have a client who's, needing more than one session a week, you do have to document in a way to show that it's medically necessary to see them more than once a week, or they run the risk of getting those claims rejected.
Right.
Yeah.
Okay. My sister just joined us. Hey there, my blood sister, down in South Florida, and she's a teacher. So happy Teacher Appreciation Week, Shay. We appreciate you. All right. So let's I guess kind of wrap things up from the standpoint of the when we talked about the approaches, we talked about the maybe someone that is concerned about receiving a diagnosis. Is there anything else that we should be mindful of as it relates to mental health diagnosis and holistic approaches to care?
I think clients, especially if they are in therapy for the first time, just to kind of ask questions. Something that I recognize whenever I get clients who are like, "This is my first time in therapy." They just kind of, they kind of follow like what you're saying and what you're telling them. Of course, putting their trust in you that know what you're doing, that you're doing the assessment, and that you're gonna. But I think like a piece that some clients may not be aware of is the diagnosis. And just as with anything, is a medical record is created that follows you. And so asking questions about the process, if you want to know about your diagnosis, what you're being labeled with, what that means, more information about. So some clients, I've had clients that specifically ask, like, a little bit more about that diagnosis and wanted education. So I'll send them like materials that kind of educate a little bit on it. And so I think I've lost the question again. I'm so sorry.
No, I was just asking if there was anything else.
Anything, yeah, just being
I
mindful.
Yeah,
Just,
no, I think you did answer it, and part
yeah,
of that is, ask lots of questions,
right,
and you need to be comfortable with the clinician that you are getting ready to essentially hire
right,
to be your counselor. Many of the clinicians, and there are a number of them on here tonight, but many of them offer like a initial maybe 15 or 20-minute consultation at no charge. And so
right,
kind of definitely lean in and ask questions and see if you have a good vibe, right? Because every clinician is not going to be for you in terms of you clicking with them or building that rapport, but you want to build a rapport because you want to be comfortable enough sharing your
right,
life journey with them, right? Because you're going to be telling them about very intimate, personal um, things about your life's experience.
right.
Hmm.
I would definitely say that just, especially for clients getting into therapy for the first time, that, it's okay. I just like anything else that you try on, I guess essentially like, making sure that it fits right. Yeah.
Yes, absolutely. All right, we got a few more folks that have joined us. Mr. Nick Rains, who is here in Tallahassee, clinician here in Tallahassee. Thank you for joining us, Brother Nick, and Miss Kesey Williams, who is also in the social work field. Appreciate you being here, Kesey. She is here in Tally. And Coach Anna said, "Good evening from Orlando. Great information. We must advocate for ourselves. Asking the right questions is key." Thank you. Yes, appreciate that. And Coach Anna will be on with us, I believe, next month to talk about grief. She is a grief guru. So looking forward to that conversation. Dr. Reed said, "What have you been delighted to see in your clients when you see them heal and grow and be their awesome selves?" Great question.
Yeah, I'm delighted to see whenever they make connections about things being different. And I say that because, sometimes clients wonder if things are changing for them. They feel like they're doing the same things. And when I'm able to kind of give them a perspective from the outside looking in, we walk through, this is how we started in this journey, and this is what I'm seeing here. So to hear them say, like, yeah, it is different. I'm doing, I'm doing it. I really love to see that.
Yes. So you're making some progress, making some headway. And as one Dr. Ken Fowler used to say, God rest his soul, I am here to offer some new solutions to some old problems.
Right.
Right? Because you've been having a problem with these problems because you keep running to the same brick wall or whatever, but we about to
Right.
look at some new solutions to these old problems, right?
Right.
And then I guess my final question, which you and I kind of talked about prior to the broadcast, was if I get a diagnosis, is that with me for life?
Yeah. Um, Somewhat. I think the way that I see it is that on a medical record perspective, it is something that stays. But let's say that you were diagnosed with depression. There's different variations of it. So, one episode recurrent, there's a way that you can go from, it can be in full remission. So even though you no longer actively have clinical depression, the label itself is still there. It's like major depressive disorder, recurrent, in full remission. That's how we'll label it. So it kind of sticks with you in that way. Is
So sticks with you in that way, but you don't have to walk in it in terms of claiming it and owning it, and you
right.
you can, as you said, be in remission from it, right?
Yeah.
So that should hopefully be the goal, right?
Right.
Mm.
Mm-hmm.
So maybe through the talk therapy, through the meds that you may have been taking, but hopefully through these coping skills that we've talked about, they will help you get through maybe those times when the diagnosis kind of flares up, right?
Right.
Mm.
Mhm.
Okay, very good. Well, we were about at time, so I'm gonna give you an opportunity to give some closing remarks and share how folks can connect with you.
Well, thank you guys so much for joining in and for the questions that you had. And I hope that I'm glad to hear that. I know some of you mentioned that this has been pretty helpful. So I'm really glad that I was just able to participate in the show and just kind of give some helpful advice regarding like mental health diagnosis and just alternative approaches to care. In terms of contact information, I know that Nicole will have it listed there, but my practice is holistic healing counseling. You can contact me with my email there and phone number. And also, if you want to follow my Instagram, is at HH Counseling. For anybody who may be looking for a therapist or would like to refer clients, I'm also found on Psychology Today as well. Just typing in Keyunda, Washington.
All righty, very good, very good. And so, are you currently taking clients?
Yes, I'm
All
currently
right,
taking clients.
all right. And you do in person or tele?
That's currently telehealth only.
Okay, in insurance or private pay?
Yes, a combination. I sub most major insurances and some EAP plans.
Okay, very good. So, hey, this is part of what Mindset Monday and Wellness Wednesday is about. So, connecting folks with clinicians of color and just clinicians in general, but that are here to help. And you serve the entire state of Florida?
Yes.
Wonderful, wonderful. So please follow her. Please connect with her. If this is something that you are interested in, if what she's talked about is something that you're interested in, by all means, please do connect with Miss Washington. If you all have found this to be helpful, let us know in the comments. Comment, let us know. Give us a thumbs up, clap your hands, heart, something. Let us know in the comments. I see a few of you are responding. And let's please keep this conversation going, because we really need to be getting our checkup from the neck up so that we can be our very best selves. All right. So I see a few folks chiming in. Miss Jackson, thank you so much. Good job. Key, she said. Chef Shack, thank you so much. Appreciate you being on here, my sister. Coach Anna, thank you. Appreciate you. Peachy, this was good. Thank you. Thank you, Peachy. Dar is in the house. Where you been, Dar? He said came in at the last minute. Stay blessed. All right. Appreciate you being here. Amazing, Dr. Reeves. Thank you, Dr. Reeves. You were on it tonight, doggone it. I appreciate you. All right, Shaq. So needed. Thank you, Dr. Williams. Miss Debbie. Thank you so much. All right, Duval is in the house. Mr. John White. Thank you for being here, Mr. John. I appreciate you. All right. So, for those of you who may be new to the platform, I invite you to subscribe to the Conversations with Nicole YouTube channel. Subscribing is supporting. We need all the support we can get. Y'all play my videos, please, on YouTube. Play my videos. I need some views really, really bad. I'm trying to reach 4,000 viewing hours within a 365-day period. So play a video every day. Every day, play a video. Play this video tomorrow. And the day after that, and the day after that. So yeah, we are here every Monday and Wednesday at 8:30 p.m. Eastern time for about an hour, focused on mental health and wellness in Black and brown communities. So we appreciate your comments, your engagement, your interaction has been wonderful tonight. Oh, look at here, Miss Tracy Ann Bennett. Thank you, my Irie. She just graduated with her master's in social work from FSU. Thank you. Here, yes, congrats. I supervise Keyunda, but I have learned so much from her. Love it. That means you were a great teacher too, uh, Dr. Reeves. Dr. Reeves and I serve on the Mental Health Council, the Big Ben, and we also have Be Kind to Your Mind coming up next Thursday at 5:30 p.m. at Walker Ford Community Center. So the entire Tallahassee and surrounding area is invited to come out and be a part of it. It's absolutely free. We're going to have dinner. We'll have youth events, adult events, vendors, DJ Deb will be there. Our focus is on the physical dimension of wellness. So we'll have yoga and Zumba and line dance, and Dr. Reeves is going to teach us about sleep, the importance of sleep in terms of our physical wellness. So it's going to be a great time. So you don't want to miss it. Walk aboard next Thursday, the 16th, 5:30 p.m. Absolutely free, although we would love for you to register on our Facebook page, which is the Mental Health Council, the Big Ben Facebook page. All right, Miss Potter said, thank you so much. Appreciate you, Miss Potter. Miss Debbie, this was outstanding. Thank you. We appreciate you. And we'll get you that information shortly. Olivia Jones enjoyed the conversation as well. Great information. Thank you, Olivia. And Brother Quasi in Atlanta. Peace and blessings to all. Thank you for being here, Brother Quasi. All right, good people. We are going to bid you farewell, but have a great rest of the evening. Have a great Mother's Day. Happy Mother's Day to all the mothers, all the surrogate mothers, the chosen mothers. We love you, mothers. We couldn't do it without you. So happy Mother's Day to you all. Happy Mother's Day to you, Keyunda.
Thank you.
Yes. All right, y'all. Have a safe one, and we'll see y'all next time.
Good night.